Okay, so I was just wondering what it's like in your career. What's your daily job?
Okay, sure. That's a complex answer. So I am a trauma surgeon is kind of what the public usually knows us as, but we also call ourselves surgical intensivists and acute care surgeon. Basically, I'm also a general surgeon. So general surgery encompasses the care of soft tissue, abdomen, breast. It's kind of a wide specialty. And then I'm subspecialized in trauma and critical care. So I did additional fellowship training in that. So basically that means that I take care of patients that are injured through serious injuries or sometimes even more smaller injuries that require multidisciplinary care, such as orthopedics, ENT, plastics, just any subspecialty. We kind of coordinate the care. But we also take care of patients in the ICU that have had surgery, so any kind of major surgeries or major illnesses. And then any kind of emergency general or acute general surgery, acute care surgery. So anytime you come into the ER with appendicitis, gallbladder sick, bowel that needs operating on, perforations, obstructions, as a general, that's all falls under us. So my day is very variable, and it is mostly consistent of what comes in to us as opposed to what is planned ahead of time. Although we do some planned ahead of time surgeries, it's really a mix. But I'd say there's three main general to my day-to-day life. The one is the acute care surgery, so that's all the, like I said, appendix, gallbladder, bowel surgery that comes in the ER that needs emergency surgery. And it also includes infections, abscesses, there's so many things. And then there's the trauma component, so anybody that's hurt, car accidents, gunshot wounds, stabbings, assaults, and then then there's the ICU component of it, and that's anybody who's critically ill that is a surgical patient as opposed to somebody who has a primarily medical problem, which is very difficult to understand, I think, sometimes, but that tells you in general.
I come up here at the beginning of fall last semester with my health science class, and me and some other students, the other girl that's supposed to be with me, she come up here with me too, and we actually saw a surgery, a general surgery. So I was wondering, with the trauma experience you have, what's the difference in general surgery and then trauma surgery?
So I'm still a general surgeon, so to kind of back up, the training explains it a little bit. So I went to medical school, just like all doctors do, and then once you graduate medical school, you have to pick a specialty, and you decide what your residency is going to be. And my residency was in general surgery, which is traditionally a 5-year program, and when you're done with that, you obtain board certification in surgery. But then I did a separate 1-year fellowship, and it's either 1 or 2 years in critical care and trauma, and so I can still do everything that general surgery can do, but then I can also do specifically care of the trauma patient, which is higher acuity, higher intensity sometimes, and involves all the acute care components of it. So what was the surgery that you saw?
I saw an appendectomy and a cholecystectomy.
Perfect.
When the guy was taking out the gallbladder, it was inflamed or whatever. The guy got into there and saw that there was stones. So he called for radiology, and they had a problem with the machine, so that delayed the surgery for a while. And we ended up having to leave at 1, so we ended up cutting that one short. But the other one was just simply taking it out, and it was pretty interesting because I went in with the RN and sat there like where she does her book and all that stuff, and got to see everything they were doing, so that was nice. So made you look at this field? Because with it being such a long process, like what was your motivation or inspiration to do surgery, period?
I think I always knew I wanted to go into medicine, and actually when I was in your position, I started getting involved in, there was a Boy Scouts Explorer Club that took me around hospitals and kind of did that kind of thing, got me into seeing it. And it just kind of fit with my personality, the ability to really kind of get involved, be there when things are the most intense and the most severely injured people. I kind of gravitated towards that. And then actually I did, because you start out going to college, and I did my undergrad in nursing, actually. So I have my BSN, and I was an RN also. Mm-hmm. And my intention was still to go to medical school, but I wanted to have that good background in nursing as well, and wanted to kind of consider that options too. So I've been in both areas, and then I was even a CNA before I went to nursing school, mm-hmm. or during nursing school. So, but when I was in med school, as far as deciding what your specialties are, you kind of get a feel for it when you're going through it. You go through different rotations, and you see what kind of fits with you and what things that you find the most interesting. But surgery was always what I loved. I didn't really know I wanted to do trauma surgery till about a year into my residency. I think I previously thought that I wanted to do like pediatric surgery, and that kind of evolved. But it was always surgery, mostly because I think of the ability to get hands-on and feel like your interventions, you can directly see the results of your work. You feel like you have your hands right on something that's going to directly make them better. Mm-hmm. Does that make sense?
Yeah. So, when you were in the process of going through your medical school, your residency or whatever, mm-hmm.
Obviously
first coming into it, you're scared, you're timid. What was like the breaking point of saying, is this really what I want to do? Can I really do this? Like, what type of, I say it as like in your surgery, what case come in that really set what you were going to do?
I wish I had a good story like that. I don't think I really have one case that happened. It was more just an evolution of feeling what clicked and what didn't click so much. It was mostly for my specific specialty or for surgery in general?
For surgery in general.
Well, when I was a first-year med student, I remember I went and shadowed some of the residents in surgery, and I went into an esophagectomy for cancer. So that's a pretty extensive surgery. It's a big deal, and you basically have to go in through the abdomen, free everything up, because you're going to pull the stomach up into the neck to create a new esophagus. And so it involved an incision in the neck, it involved an incision in the abdomen, and sometimes it even involves an incision in the chest to get it all freed up. And so it's a long, long surgery, and I was a brand new student, and probably didn't eat like I should have before surgery, and